I'm Karen Hitchcock. Thanks so much for inviting me to speak here. But I just thought I'd give you some thoughts about my experience as a doctor over the last 4 or 5 years working with cannabinoids in my practice. So I was when the TGA changed the scheduling, I was working in a giant city hospital in Melbourne, and we sort of heard that the TGA had changed the rules, and we had no idea, like, how do you prescribe it? What do you get your script pad and write 5 bongs before bed? I mean, we really had no idea. And I was writing at the time for the monthly magazine and decided to write an article on cannabis and also psychedelics as medical therapies. And in the process of doing that, worked out how I could become authorised as a medicinal cannabis prescriber, and then fled the hospital immediately and set up my own little slow medicine clinic, practicing without rules or institutions or a boss, which was the best thing I ever did. So the current state of play regarding medicinal cannabis, just my thoughts. Firstly, I just would like to say that I believe that medicinal cannabis cannabis should just be legal for everyone. You should be able to grow your own, and one of the major advantages of that from my point of view would be to cut out big pharma, despite the fact that it has this sort of compassionate green veneer. The cannabis producing companies, they are just big pharma. One question that people often ask me is what's the difference between medical use of cannabis and recreational use? And I think that the answer to that question is really complicated when we are in a setting of prohibition, which we are at the moment. And I often think about the prohibition in the 1920s of alcohol in the United States and how it was illegal to use alcohol recreationally, but you could go to your doctor and get a script for whiskey for your nerves. And I just think about that situation and think that there must have been loads of doctors swapping scripts, you know, without demanding placebo-controlled, randomised control trial evidence. So it's complicated because at the moment, if you want to use cannabis, you may find yourself going to a doctor just to get a script so the cops leave you alone. But if we just put that aside for a moment, the complications that we're in a time of prohibition and you are risking legal action if you use cannabis without a doctor's prescription. When a patient goes to a doctor, I think it's never just about the drug. Patients aren't coming to me as a doctor because they want cannabis. They're coming to me because they're struggling with something and are trying to find a way towards healing. And they need to tell their story to someone. And my job in that setting is really to listen with curiosity and an open heart and an open mind, and help my patients discover what it is that's not working for them. I think that when it comes to the human subject and the interaction between a patient and a doctor, there's so many things that contribute to homeostasis, or, you know, the resting state of the human being. We've got mental, physical, and also emotional aspects to ourselves. And a doctor's job is never to simply hand over a prescription. It should be the forging of a relationship that moves towards a healing. And Western medicine's great failure and shame, I think, is that it's all become about a drug, and which supports what is the most profitable industry in the history of the world, big pharma. And in the medicinal cannabis world, the industry, they call doctors prescribers, which is, you know, just seems to be illustrative of that. Having said that, what is medicinal cannabis? Medicinal cannabis is the same as non-medicinal cannabis, and in the pharmacopoeia that a doctor can access now, there are over 150 different cultivars or strains of whole herb cannabis that can be prescribed. There's oils, tinctures, creams, capsules, sprays, basically the same things, except maybe not chocolates, that you could get in a Californian dispensary. How do you get a script? I don't even know if these are things that you probably already know all of this, but you can go to a real doctor, or you can, if you're just after a script so that you are left alone by the law, then there's telephone 5-minute consult lines. Any doctor can technically prescribe medicinal cannabis, although there is a lot of pushback from the medical community. There's a lot of dodgy stuff that goes on, so there are doctors who have set up their own cannabis companies and then clinics attached to those companies with doctors who prescribe only the cannabis from those companies. It's all pretty yucky, actually. Anyone can get a script. The list of indications is endless. Anyone who doesn't have a psychotic disorder or a substance use disorder, they're really the only two contraindications to the prescription of medicinal cannabis. And the main reason that patients over Australia, the most common reason is for insomnia, which weed is excellent for, obviously, and anxiety. They're the two main indications at the moment in Australia. Why would somebody prescribe medicinal cannabis or use medicinal cannabis? It has a very poor evidence base, which is not going to change because you can't really patent cannabis, so there's not going to be gigantic trials that go on. I think it's an experiential medicine, and I explain to my patients that this is going to be an experiment which has one participant, and that is them, and I learn just as much from my patients as they would learn from me. Cannabis doesn't cure anything, but it can help you feel a lot better and enable you to continue doing the things that you need to do to heal yourself. As a drug, it has many positives over traditional sleeping tablets or analgesics, in that you can't overdose. No one's ever died from cannabis. It's far less addictive and gives you a feeling of euphoria. So it's a really wonderful medicine to use clinically because it makes everyone feel better about anything. Yeah, so I just thought that that was all I was going to say, and that you could ask any questions if you wanted to.
Are you up for questions, Karen?
Yeah, for sure.
Cool.
Teach me.
Yep, we have one here coming with the microphone.
Hello,
Hi.
It's Fiona.
Oh, Fiona, hi.
Hi, Karen. So lovely to see you. Really enjoyed
likewise.
that. I just had a thought. Like, you said that there was only 2 counter indicators for prescribing medicinal cannabis. That doesn't seem like many. And like, would there be any other prescription medicines that would have so few counter indicators for prescribing?
Like absolute contraindications, they're so few. Well, look, there are little things like if a patient's on certain blood thinners, we have to monitor them. So there are absolute contraindications. Means if the patient has had a psychotic episode, it is absolutely prohibited to prescribe medicinal cannabis. I don't know that there would be. I don't know.
I don't
is
know.
the answer.
When you're prescribing an opioid, would there be more reasons not to prescribe it?
I don't think so. I don't think so. So prescribing an opiate would also be limited by the other contraindication with medicinal cannabis, in that if the patient has substance use disorder, whatever you want to define that as, that you wouldn't be able to prescribe an opiate.
Can you tell us a bit about what, when doctors get together and talk privately, what's the feeling about it? I mean, is it a divided community about the use of medicinal cannabis?
Yes, there certainly is. I mean, things are changing very slowly, but when I worked in the city hospitals, one of my jobs was to give the junior doctors their talk on how to take a drug history. And I would start the talk by saying doctors are not normal. And because I would have junior doctors who, they didn't even know what a bong was. So it's like, how can you interact with the general population and try and work out what's going on for them if you have no idea about, you know, what might be the common drug use patterns, etc. So I think a lot of doctors just have no experience with cannabis. I've loved cannabis for over 30 years, so when I heard that it was to be used clinically, I thought this will be excellent and was, you know, prepared to go down that pathway. I get a lot of referrals, because I'm a specialist, I get a lot of referrals from my colleagues who know me and have worked with me in hospitals and trust me, and so they are not prepared to prescribe cannabis themselves, and it is very complex. I mean, it's a wily, complex, beautiful plant that I think takes a long time to know how to use clinically. But there are, I remember when I first started, a respiratory physician rang me up and said, oh, my patients asked me to refer her to you, and she said, but you know, she said, what is it like? Like, are you terrified? And I said, why? And she goes, well, what happens if you say no to someone? It's just like, what do you think they're going to do? And also, why would you? So, and there are a lot of doctors who are using medicinal cannabis, you know, just like 3 things, THC, CBD, and a half-half blend, and who have never even used cannabis. And I mean, it's such an experiential medicine. I consider it a psychedelic medicine, and so set and setting makes a difference, and it must be very difficult to guide a patient, particularly patients who I mean, it's so hard to describe to a patient what THC is going to feel like and how to, you know, ease into it so that they don't get panicked and et cetera, et cetera. So there are some doctors who are using cannabinoids in their treatment who have never used it before. There are a vast number of doctors who have never, ever used cannabis recreationally before, and so are very scared of it and are demanding huge randomised control trial evidence, which we'll never, ever have, ever.
Wait a sec, Robbie, I'll just come back.
So to follow on from that, I know, but if you had to make an estimate, how many doctors do you think would be users of cannabis in their private life?
It's fun. It tends to be the boomers, actually. The younger doctors don't. I don't know. So I can't give you a percentage, but a low percentage. A low percentage. And I do have patients coming to me who are unable to obtain referrals from their normal GP and had to get an online referral from an anonymous doctor from just one of those telephone clinics. I mean, there's many doctors, most doctors you don't need a referral to go to. It is very, very easy to get a script for medicinal cannabis now, as long as you can pay for it. There's lots of telephone lines, 5 minutes on the phone, and you can get a crate of weed delivered to your house every month.
You have a question?
Yeah, thanks. Hi, Karen.
Hi.
James.
James, hi.
Yeah, hi.
All my friends are asking me questions. Thanks. Thanks, guys.
So I saw that a cannabis-assisted therapy clinic was set up in Melbourne for the first time a few
Set up
days
where?
ago. In Melbourne.
Oh, really?
Yes. Sorry. Okay. Yeah, and you know, as we've discussed, potentially cannabis, you know, as used as a psychedelic, could be a very effective therapy, and indeed there's a book from America on that very topic.
McQueen, I think,
Exactly,
is that his name?
exactly. So I'm wondering what would be involved in setting up a cannabis-assisted therapy clinic, who might have to be involved, and also how we select. I mean, there's a myriad of different cannabis products out there, and we probably want, you know, we could titrate the amount of THC and so forth, but, you know, are there some cannabinoids that are going to be more effective for therapy than others, going to give a bit of a psychedelic effect? It'd be really
Well,
interesting.
McQueen, in his book, it's interesting, and I sort of did a deep dive into the research after I read what he claimed and could find nothing backing it up. But what he claims is, so he uses with his patients vaporized dry herb, and he uses a mix. He says he mixes a blend, so sativa, a hybrid and an indica, and then he uses an aged indica, which the THC with exposure to ultraviolet light in the plant, the dried plant, turns the THC apparently into CBN, and his claim is that CBN is the potent psychedelic. Now, you can get a variety of oils that have got a whack of CBN put in them, and I don't know. I think it's an experience, as I said before, it's an experiential medicine, and it would involve just playing around with it and just thinking about what I guess you would say a sativa would be more psychedelic than particularly the oils are than a heavy indica THC oil, but it would be all about the THC really, and about the set and the setting. But he does vaporize, so the therapies only last a short amount of time, and he also uses it in lower doses, just in traditional 1-hour psychotherapy. I can see it would be really helpful.
And any idea what would that involve legislatively, or who should be involved in terms of actually setting up a cannabis-assisted therapy clinic?
Well, I'm not sure. I think theoretically, legislatively, it should be legal right now, because you would need a doctor to prescribe it to the patient, just as is going to happen with psilocybin and MDMA. You would need a doctor to prescribe it. I mean, we're handing out scripts and people are going home and using it, so why would there be a prohibition against prescribing to a patient and then having them in your rooms for X number of hours while they ingest what you've prescribed? The ketamine situation would be the same. You can prescribe low-dose ketamine for an outpatient setting, and you can also give high-dose ketamine in a clinic as a treatment, psychiatric or pain or... So you could just set up shop. That's interesting. Has that clinic started? Because I had talked to a doctor a couple of months ago who was going to start that. Yeah,
it was. I saw it the other day in a publication that I can't remember, but yes, it got launched the other day.
Yeah, well, I'd be interested to see how that turns out, actually. I've often wished that in the cannabis-naive patient who comes to me, that I would be able to administer with them their first doses in a supervised setting, because you could just push it really hard, and then, if they freak out because they didn't expect to feel so amazing, that they could, you would be there with them. And you can work with it. I mean, cannabis, you can take it and go to sleep, you can take it and go to a party, you can take it and think, and it does open pathways because it's psychedelic. So it could be, I will see how that goes. What, do you want to set up a clinic, James?
Hello.
Hi.
I would like to ask if there are any adverse effects reported by the patients, and if any of them would cause any patients to withdraw from the taking or using cannabis for medical purposes.
Oh, absolutely. Yep. Particularly in the setting of pain, patients withdraw because it's so intoxicating, and at very, very low doses it tends to not be helpful. If we're talking THC, that would be the main reasons. There are a few cases with CBD where it causes gastrointestinal problems. Rarely, but I've seen at least one patient it causes liver function deregulation. But we don't know what that means. It's just that on a blood test it shows that their liver's inflamed and needs to be withdrawn, but that's rare. Some people are very sensitive to CBD, and it seems to make them feel flat and hedonic rather than just less anxious. But the THC, particularly for the patients who don't know have never experienced it before can often withdraw just because they feel a bit unsteady on their feet, or they're, very rarely do people withdraw because of anxiety, which is one of the main things that patients who have used cannabis come to me and they say that they used it in their teen years or their early 20s and it made them really anxious and paranoid, and so they're really nervous about it. And I haven't had any patients in whom that manifests subsequently when I prescribe them medicinal cannabis. Set and setting and guidance.
Thank you.
So Karen, I noticed that that with vaporising is the latest boogeyman. So because we're worried about what the children are doing. So as we know, so medically to use a vaporizer for, say, for instance, quitting cigarette smoking, you have to do that via a doctor and get a prescription or whatever. So how is it with, like, I'm assuming, of course, when medical cannabis is prescribed, that if someone is using flower, it's via a vaporizer. So yeah, do these changes that are going on federally to do with vaporizers, will that impact on medical cannabis users, or will it be like with tobacco where you have to get the prescription from the doctor to get the vaporizer?
With nicotine, you need the prescription just for the nicotine liquid. So the actual vape device, the power source or the pen or the whatever, doesn't require a prescription. And the same goes with medicinal cannabis. I think that to be technically medically legal, you are supposed to use a herb vaporizer. But I'm not sure. I'm not the police, and I just talk to my patients about the pros and cons of smoking joints versus using a herb vaporizer. So a herb vaporizer has got nothing to do with the concerns about the nicotine vaping. It's a completely different thing. It just heats up the herb and releases the aromatics which you inhale and directly into your bloodstream, etc., etc. There's no risk of contamination, and I think one of the things that made the medical community and the legislators a bit hysterical about the nicotine vaping or the THC vaping was that company in the United States a couple of years ago who put the THC vape cartridges, the carrier oil was vitamin E oil, which is highly toxic to the lungs and cause like popcorn lung and all that stuff. So I don't think that that's going to be touched. There are THC liquid vapes now. A couple of companies are doing that, just like nicotine vapes. You get the little power source, and what I prescribe is a cartridge that clicks into the power source. So again, what I'm prescribing is the equivalent of the nicotine. I'm prescribing a liquid with the active components of cannabis in it that then goes into a little vape pen, and I haven't heard anyone. I only ever had one patient whose lung doctor told him that if he vaped the vaporizer that I had prescribed him, that he would die. So that's the only resistance that I've met, really. And I don't think that regulatory bodies are going to give a damn.
Okay, thank you. There's another question here at the front.
Hi. I've got a question about, I'm up here in the front. Hi. So occasionally when I've been dry herb vaping for years, and occasionally it makes me more sensitive to pain. I vape it for pain, and sometimes it just increases my sensitivity so much that it makes the pain unbearable.
Yeah.
Is there anything I can do for that?
Look, that's so interesting. I think one way I have of describing to my patients how cannabis might be helpful as an analgesic, a painkiller, is that I say this: if you cut your hand and then say, I don't know, vape or smoke a joint, and focus on that, it will be exquisitely painful, because it's a sensory enhancer. So and so it's like, well, how does something that is a sensory enhancer act as an analgesic. And I think that from what I've seen with my patients, that the deal is that if you cut yourself and you use some cannabis, what that cannabis does is it enables you to distract yourself or to focus on something else such that you forget you have a hand. And so it could be the way that you are working with your cannabis, it could be that in those moments where your pain becomes exquisitely torturous to you, that maybe you can set up some, I don't know, some practice that you then can fall back on in those times, like be it meditation or listening to Pink Floyd or, you know, walking in the garden, something that enables you to take your focus away from your pain, because cannabis will enable you to shift your focus. And so you have to, it's not a passive drug. It's not a general anesthetic that is going to work and knock you out every single time. It is a drug that has a very complex interaction with us as human beings. And so I think the answer to you is a behavioural one.
Thank you. Second question. Occasionally, it also gives me like serotonin syndrome. With extreme like cutting, stabbing, stomach pains, and I end up in hospital getting fentanyl, and it's horrible. And so they've been telling me I've got to stop the cannabis because they think that's causing it. I don't think it's causing it because sometimes I get those attacks without the cannabis as well.
Ah, well, there you go. I mean, so, that's the thing, right? If you get the attacks with no cannabis, then the cannabis is not causing the attacks. And also it doesn't sound like serotonin syndrome.
I can't take any antiemetics, and I go into hospital, you know, vomiting violently. So they've called it serotonin syndrome. So you vomit
during these, yeah, okay. Do you know about the cannabis hyperemesis syndrome, which is cyclical vomiting, which is associated with high doses of THC, but you're saying that it doesn't necessarily happen when you're actually using your cannabis, so that's...
Correct. It has happened a few times without any cannabis involved.
Yeah. Like none for a couple of days or none for an hour?
Days.
Days. Yeah. Okay. Well, that sounds unusual to me, and I don't know. Just with that little bit of information you've given me, I would, if I were seeing you in the hospital and you told me that you hadn't had cannabis for days and yet you had these symptoms again, I think in order to look, cannabis gets blamed for everything.
They really
everything.
Do. Because when I haven't had the cannabis and I come in with exactly the same symptoms, they tell me it's THC withdrawal.
Right, that's right. Yeah, that's right. It's withdrawal and overdose and use and, you know, yeah.
So would
I'm
you
sorry
suggest,
that happens to you.
Would you suggest trying not having it for a while and seeing what happens, or because they're not particularly helpful in the hospital?
Because what did you say?
They're not particularly helpful in the hospital, and yeah, I'm just wondering whether to try not having the cannabis for a while and seeing if more attacks happen, or do I change the form of cannabis that I'm taking?
I think you should see a gastroenterologist and get somebody who's actually going to listen to you and think clearly about what's happening to you without just knee-jerk reacting, saying it's the weed.
Yeah, thank you.
Okay, do we have any more questions? Yeah, Martin?
Karen, it's Martin.
Martin, see,
hey.
all my friends.
I'm back.
We've stacked the room.
I know, that's right.
Just a quick one. Does cannabis lend itself to combination therapies with any other medications or with psychedelics, for example?
Yeah,
Are
definitely.
you familiar with these and how they could work?
So what was the last bit, Martin?
Oh, and how they could be applied in a therapeutic context.
Yeah. So there is a bit of evidence that a sub-therapeutic dose of an opiate medication with a sub-therapeutic, like non-intoxicating dose of THC act synergistically as an analgesic, so that can be good. And I've worked with a lot of patients who are on high-dose opiates and just got their doses down really low, and then a little bit of THC on top of that is useful. Cannabis is definitely synergistic with psilocybin. So tiny dose of psilocybin, some weed, tripping like crazy. But in the clinical circumstance, it's the opiate cannabis that I'm most familiar with.
Yep. Oh, thanks. Oh, a friend of a friend of a friend of a friend used to use it also to settle stomach on some psychedelics which otherwise would cause significant nausea.
Nausea, yes, definitely. That also, yep.
Thank you.
Can help you stop puking.
Karen, you did mention earlier how it's become easier. Like February 2016 was when it was announced that cannabis was legal federally, medically. And as we know, it's been an evolution. At the beginning, you had to be an authorised prescriber as a doctor. They were very restrictive about the particular ailments, depending on what state you were in, all that kind of thing.
And there were like 3 products available that were $500 a bottle.
Yeah, so
it was hopeless.
Yeah, so as we know, it's evolved to be more widely spread available. And however, I can't help but feel, and I'm happy about this, of course, because I'm a recreational user, that like what happened in the US or in Canada, that basically it's like, I'm sorry to say, but the doctors are the new kind of like drug dealers in terms of cannabis.
Well, they are literally, if they run their own pharmaceutical company and their own clinic. I mean, definitely.
Yeah, so I guess it would be interesting, and I'm wondering what you think in regards to this helping the evolution towards indeed a recreational market. Because it's kind of being calling a spade, because I think that's what was put forward in Canada, for instance, as in the medical system is supporting a recreational market. Do you see, I know Australia's always a little bit behind in terms of those ways of thinking, especially politicians. Yeah, what do you think? Do you think it'll evolve into a recreational market, or are we going to be...
I really hope so. I really hope so for so many reasons. Firstly, just because, like, it's ridiculous. And secondly, because of exactly what you're saying. I mean, I find it really insulting to be called a prescriber by, you know, these bunch of drug companies. They can get fucked. Like, I'm not a prescriber, I'm a doctor, and I think that once it's recreationally legal, then it'll just make it so much easier for doctors who actually want to use cannabinoids to help people healing. Like, there won't be any of this ambiguity anymore. But it is the case that it is very easy now to get a script, and so you're not going to see that doctor who's on the end of the phone as a patient. You're just going to get a legal script, and that's fine, and that's what we've got to work with at the moment. But I can't wait till that stops, so I can stop being called a prescriber and don't have to field out, you know. But look, I get young, particularly young guys who come to me and they're smoking, like, I don't know, an ounce every 4 days, and I'm just like, well, you know, if you want to keep doing that, I'm not the person that you should see. You know, go and ring, and I've got a list. Go and ring these places, and then you can. That is your right. But if you would like to work with me and try and get to the bottom of why you've got to be smoking these vast amounts of cannabis, you haven't got a job, you don't leave your house, blah, 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 then I will help you. And the overwhelming majority of those boys want to work with me and have fantastic outcomes. And not only that, this is like one positive about it being medically, you know, supervised as the first step. A lot of the young men that I see have never seen a doctor. They've never had a blood test. I had one guy that had a great big hole through the septum of his nose from cocaine use, and I sent him to an ENT surgeon because he didn't know that you're not supposed to have that, you know. So there's a lot of positives, even in patients who might be coming and they land with me, who sits with them for an hour rather than just a 5-minute phone call. I see those as opportunities to just help the wellness of these people who just happen to come across this clinic rather than the phone line clinic. But I always give the choice. I'm not the police, and I in no way want to tell anyone what to do, but if they want to work with me, I will, you know, welcome them with open arms and do my best by them.
Yeah, wow, it sounds like accidentally there are a few people getting some actual medical help when they've got problems.
Yeah.
So, yeah, because definitely it seems to me that if the different markets are separated, then indeed people with serious medical issues who need help can get the proper help.
Totally.
Yeah.
I won't lose any patients from my clinic once it's recreationally legal. There are vast numbers of clinics that will shut shops overnight because that's basically what they're doing. They're servicing that. And again, I think that's great and they should do that. And, you know, if that's all we've got to work with at the moment. But really, the end game has to be you can grow it yourself. Like, it's ridiculous. It's called weed for a reason. You just chuck a seed and 12 weeks later, you know, instead of going to the pharmacy and getting your little canister of pink kush that costs $200. You know.
Very true. Do we have any more questions? Might wind it up there. Okay, thank you very much,
Thank you so
Dr.
much.
Karen Hitchcock. Woo-hoo.